Thank you very much. Any questions? Any one of you who's using NAVA and these neonates, just to get a feedback here?
Thank you, Lisa. When we were doing our original work with non-invasive NAVA and the rabbits with the acute lung injury, what we found was that we extubated them and we put them on NAVA, but we had to increase the NAVA level 4 times to compensate for the huge leak we had. We were losing 75% of the pressure. We measured the prong pressure and tracheal pressure, and we were losing 75% of the pressure, and I had to go up 4 times in the NAVA level to unload the animal as much as when he was intubated. And I'm just single prong in one nostril. So I was just wondering if you find that when you switch them over and you go smoothly, if you have to go up in the NAVA level or not because of that huge leak.
These babies are recovering, so they are getting better, and we extubate when we assume that they can cope with less support. What has succeeded in our practice well before is to go from ventilator from SIMV to CPAP. Now we have these additional steps there, and it's smoother, but it's going downwards. And now NIV-NAVA is an alternative to CPAP, so we think that all small breaths we are getting, they are more than they would get on CPAP. And if we think they would need more support, I think we wouldn't extubate them. I think it depends on the threshold for your extubation, how much you need to have NAVA level, but we really have with these tiny babies these belly problems, and I would be worried to give more than 2 NAVA level non-invasively.
Do you start off babies on NIV-NAVA?
No.
From day one, do you, like, instead of intubating?
No, but that is something we are planning to do as a research protocol.
There are some clinics in the US who are starting from day one that seems to be very successful with that. Not in every patient, but in many patients they can totally avoid intubation.
We have our early CPAP, and if that fails, we intubate and we give surfactant. And now what we could do is to compare if NIV-NAVA compared to early nasal CPAP is superior. And that is, I think that is something that should be studied, and we are planning to do it.
Okay, anyone else with a question? Yeah.
Thank you for a very interesting presentation. And you've mentioned that the catheter you placed has narrow lumen. So on NIV-NAVA, you've seen more over distension of the stomach. Do you have any strict guidelines how often then the air should be aspirated when you have newborns on NIV-NAVA, or any idea how to cope with that?
Our care routine is to aspirate prior to next feeding, and we feed the babies every 3 hours. It's also to see the residuals and to determine how much you can go up with milk.
So no special care is needed? No more often than every 4 hours for the feeding?
Not routinely. Of course, there are situations where you have needed ventilation or something like that, and you have to acutely aspirate the stomach to get more room for the lungs in the chest. In normal routine care, we aspirate every 3 hours.